Hi, so our presentation is the QI proposal for improving care in rural Rwanda.
So our case study for this project was based in Kirehe Hospital in rural Rwanda, and this map just shows that it's located centrally in Africa, and Rwanda is near Uganda, and this region is specifically near the border of Tanzania. Several important challenges were identified in our root cause analysis, and one of these is poverty. And this graph just briefly shows of all the regions in Rwanda, Kirehe similarly has a poverty rate of about 50%, with many of the residents being identified as extremely poor. To provide a real-life example of this, only about 27% of the residents have access to running water in their homes. Many of them do not have access to protected water sources and have to use streams and rivers to access water. This also shows, this map shows that on average, the residents need to walk about 75 minutes just to access basic healthcare services, which you can imagine is very challenging when trying to look after your health. Another key challenge identified in our analysis was lack of education, and as a real-life example, this map shows that the net attendance at high school in Kirehe is very low, only at about 11%, so most of them only have access to primary schooling. Similarly, there's a very low rate in Kirehe of computer literacy. Less than 5% said that they had ever used or were comfortable using a computer, for example. So this is something you need to keep in mind when working with your patients.
So, while the occurrence rate of HIV has been dramatically declined all over the world due to antiretroviral drugs, it's still a significant issue in a lot of rural communities, including this one in Rwanda. So, the aim of this proposal is to describe an HIV prevention to lower the rates of HIV and educate our patients regarding this diagnosis. And we identified four subgroups that we find is the issue when it comes to this problem. And the first one being patients.
So I really went over some of the challenges that we identified. I really described the low rates of education and poverty as important challenges. Another problem that we identified in the community was the high rates of unsafe sex practices.
And the second problem is the infrastructure. A lot of places in a rural community, they often lack just even the most basic resources, such as bed linens or unpaved roads, or just the building itself is just not it's not properly for a hospital setting. So in order to us to improve the medical services, we need to improve the medical equipment. We need to also improve the technology and computers that physicians should use to provide a consistent treatment for our patients who have HIV. And one of our recommendations is to implement a EMR system, which is a computer-based data system where physicians are able to have access to the latest laboratory results in order to provide the best treatment for patients who have these diagnoses.
The third problem that we identified was staff. There was understaffed, not enough training, pneumatic rotation, lack of leadership, and lack of communication. The action point that need to be initiated in order to improve quality care in Rwanda was to implementing suitable working and educating the staff to be more effective, improving the infrastructure, and most importantly, educating the staff, the nurses, to equip them with the in-depth knowledge to enable to care for the patient. And once we did that, we could propose the quality improvement project to implement um, there will be sustainable improvement in the care service in Rwanda. Thirdly, will be after implementing the QI to initiative, like the next process will be assessing the results of the outcome of the project in order to measure how effective it was and impact, or what was the impact on people's lives.
So the program in Rwanda had many issues regarding their policies, which included rushed meetings, insufficient documentation or not documenting properly, and having a laissez-faire approach. To improve the policy of the program, we do propose transitioning from a laissez-faire approach to a democratic one to have the program run more smoothly. This will allow the staff to express their concerns, ideas on what can be improved, and what they enjoy about what they do, which will be measured through surveys. This approach will also empower the staff to advocate against rushed meetings, increase their time availability for their patients and documentation, and it will make it easier to have consistent documentation and improve their time management. We also propose task shifting, which allows physicians and nurse managers to delegate their tasks to their staff and their nurses. This gives the staff autonomy. It promotes a sense of pride, job satisfaction, and independence, and it will ultimately improve patient outcomes. With a policy that will allow for quality improvement, the community in Rwanda and the staff in the clinic together can help reduce the rates of HIV infection and increase HIV education, which will ultimately lead to the opposite of our problem.
This brings us to the process flow component of our project. So as we stated, the primary objective of our project was to address the problem low rates of HIV prevention and education in rural Rwanda. So something a little unusual about our project worth mentioning is that instead of working on a single event that might have gone wrong in a healthcare setting, we had to really set up a whole system from scratch and therefore develop a process flow. And in order to do this, we used our root cause analysis of the case study, we consulted the literature, and we also used HIV prevention guidelines from the WHO. The overall aim of this project was to standardize voluntary HIV testing and treatment and to integrate this into routine nursing care. Some highlights of our process flow. It starts from when a patient enters the hospital. They're entered into the medical record with the demographic information, and then the nurse would carry out their assessment, get some vitals, and importantly, document this in the chart. Crucially, the patient would be offered a routine HIV test, and if they provide consent for this testing, the nurse would follow a specific protocol to carry out the testing to get labs, and if not, the patient would still be provided with educational materials. Importantly, confidentiality would be maintained throughout, and if the patient was indeed diagnosed as HIV positive, then the healthcare team would again follow a standard protocol to inform the patient and provide post-test counseling. At patient discharge, if the patient was diagnosed as HIV positive, it would be very important that the nurse provide education on the patient-specific medication regime, because ARV medications can be very complex, and in order to assess patients' understanding, we would use the teach-back method, and the nurse would document this education. Our process flow includes a very important element, which is a community support using community health workers who are able to provide home visits in the community to give very important psychosocial support, and also assess the need for material support in the community, such as the need for essential food, supplies, transportation, and so on. Patients would be reminded to follow up at the healthcare center, leading back to the inpatient or part A of our process flow.
where the nurse would evaluate the effectiveness of the HIV treatment. And this would also provide us a way of ongoing evaluation of our QI project. In order to assess the effectiveness of our intervention, we would want to use surveys to assess patient satisfaction. We'd also want to assess the levels of patient adherence with their medication regimens. And finally, we would also want to know whether our intervention is in fact lowering the rates of HIV in the KIA community, which would be the overall goal.